we have to remember why we're doing this. We're doing this to better take care of people. We're not doing it, yes, there's a business case that we have to have, but one thing that's wonderful, it's kept me in healthcare for so many years, is that we're mission oriented. We're about the people and making them better. And so you can't do that if you don't know them, understand them, listen to them.
Hello, healthcare. We are so excited to be at HMPS on the floor, excited to have the opportunity to meet with people again and have these discussions. We wanted to share a bit of the conference with you and some of the overarching themes that we've seen. A lot of the themes that you might hear about from HMPS as you watch these videos are around transforming consumer experiences, transforming patient experiences with the context of the people that we're serving. And there's no better way to start focusing on that than this newer concepts around human-centered and user-centered planning and design. So to see that Sue Jablonski, who is Chief Marketing Officer and Senior Vice President at OhioHealth, to see that she was delivering a talk on this topic, user-centered planning and design and virtual health, we were really excited to be able to bring her on. So Susan, could you just share a little bit of background on your interest in that subject and just background on you and how you got here and how you kind of discovered this concept of user-centered planning and design?
Sure. So at OhioHealth, as our marketing team has grown, I know when I started there 13 years ago and took that job, I had a one-person digital team. Now our digital team, I haven't counted it up, but it's probably 30 some, because digital team also includes a big UX team, user experience. And so as we've grown the team and worked to deliver products and services for our patients and for the organization, we know that we have to start with a different lens, not the internal lens, but the user lens. So it's really the start of how we get anything going before we even, begin to visualize a product or a service.
Great. And a lot of people, I know that we've actually had a couple of talks on planning and things like that. And I feel like with planning, it's a situation where a lot of people might think that they're doing it well, but might be missing some key elements. So when we say user-centered planning and design and the discovery path towards that, what's the difference between that and kind of conventional or past ways of doing planning?
So in the past, if we were going to, let's just say virtual health, if we were going to start virtual health, we would start by talking to our doctors. What do you want to do virtually with patients? What's important to you? And we flip that and we first start with the user, but then we bring everybody together. So we have a slide in the talk that we're giving about this that shows, 15, 16 different people in the room. There's a respiratory therapist, there's a patient, there's a physician, there's all kinds of different people because they're all users. But in healthcare, we have to start with the end user, which is the patient or the consumer.
Excellent. So that's really exciting. I love hearing about all the people in the room, including the patient who's not always in that room.
Right.
Could you talk about the discovery of this process and this idea to bring everybody together and start gathering their context?
Yeah. So we're in an age where everybody's talking about agile. And there's design thinking and all those kind of things. And there's a specialty that's developed, which is user experience. UX is what we call it. And I know it's interesting. Our UX team, for example, one of my UX people is actually an industrial designer. And I never would have hired an industrial designer 5 or 6 years ago. But she comes at things very differently. So what we've realized is healthcare is so far behind in delivering products and services that really are designed to meet the needs because they've listened to the consumer. I mean, think about retail and think about banking and even insurance, and your ability to get your product. I can be standing in the grocery store line and buy some insurance, right? And healthcare hasn't been like that because we haven't been listening to our customers. We've been listening to what the doctors and the administrators, so the white coats and the suit coats, have been driving what we did. And we're turning the tide. It's really fun.
Great. Yeah, I love the way that you're turning the tide. I love the way that a lot of this came from hiring somebody from an industrial design background, so somebody with a different background in healthcare, and then listening to the employee and like bubbling up a lot of the initiatives outside of healthcare.
We do a lot. So I remember one time when I shadowed one of our UX people, and we were dealing with an issue at the hospital on throughput in the emergency departments. So I spent 5 hours with her in our busiest emergency department and just watched her observe and ask people questions, and she's just listening. And then we went back to this kind of war room where other people, UX people, were doing it in other of our hospitals, and they were mapping, and there were post-it notes and journeys and friction points. And how can we fix this? And so the way they think is differently, and it's really exciting.
I'd love to zoom in on one of these use cases. I know that you'll be talking about virtual health.
Right.
Would that be a good one to zoom in?
Sure.
I'm just kind of like, I like the concept of here's how our listening works, and here's the process that we go through in journey mapping. Can you talk us through that with the virtual health?
Yeah, so with virtual health, I give you the context that we had, luckily, before COVID, we had been working on virtual health. So we had set it up a little bit, not a lot. It was not scalable or anything like that. And we set board goals at OhioHealth, and we had a 3-year board goal to get virtual health throughout all of our employed physician offices and in our specialty services and all of that. So we had 3 years. And then COVID hit. And so luckily, we had already done some user sessions with like some patients in primary care and things like that. Like, what would you consider doing virtually? We had been talking to physicians and things like that. So we just put it on fast forward like everybody else. And we tried to bring in research we had from other things, because our 3-year board goal got cut down, and we were up and operating fully across many specialties in 6 weeks. So it goes to show that you can do it. So we were up, and we were able to use some of the insights that we had from previous. But once we were up, we kept iterating. We kept going back to the users. Now, we couldn't do it in person because of COVID, but talking to our patients and what the experience was, and how long were they waiting in the virtual waiting room? How could we do that? And so we would reach out to them. Rather than just looking at benchmarks in the industry, we wanted to create kind of our own benchmarks based on what our patients were telling us.
Great. So I love the concept of like we're newly listening to patients and crafting this experience. Were there insights that you guys got, or tendencies, trends that you saw that you weren't expecting?
Oh, geez. There were probably many of them because we were moving so fast. So I'll tell you one it's not really, I guess it is an insight. We wrongly assumed that a lot of our elderly patients would be really hesitant about it because it's technology, and they were all over it. They were all over it. And when we dug a little deeper and talked to them, some of the reasons were they still just wanted to be able to connect. So the fact that they could have a connection with their doctor who they trusted, and often we had to work them through sometimes on technical, or they had somebody, helping them. So that was really interesting. The other thing was how people were open to the dialogue. So it really had become a two-way street. So if the doctor if I had a rash or something, right? And you can only see so much on that. So asking questions and going deeper. And so the patient ends up getting more involved in the care. They're less passive. They have to be more engaged when you're trying to connect virtually versus in person. So those are a couple of things that come to mind right away.
That's a really powerful evolution in healthcare in general. Like, we're coming from long ago when people would be diagnosed from something and not even be privy to the knowledge of what they're being diagnosed to. Now people are participating. Yeah,
and it's interesting you say that too, because back it was in 2011 when we had done a lot of work on our brand promise at OhioHealth. And our brand promise, it's 8 simple words that took forever to get to.
Good.
But is a trusted partner in your best health. And we talked about that partnership and how it's evolved. So my parents did whatever the doctor said. The doctor was king, queen, whatever. My generation, edge on the baby boomer, it was like, oh, I still have some questions. I have a little information. And then the younger ones really want to be engaged. But like when it comes down to it, healthcare is the most personal thing that you have besides your money. And so I hope if you're my physician that although I come in and I've Googled and I know what you want to do, I hope you're a little bit smarter than me, and we'll ask a few more questions. And so virtual health is allowing that partnership in a whole different way. And I think that helps to build trust.
Fantastic. And yeah, honestly, when you said a trusted partner in your best health, partner was the word that I cued.
Yeah, right.
Yeah.
Right. And it's so important. I mean, I just, if I'm going to talk to my doctor, I'm going to share things with my physician that I may not even share with my spouse, right? So you've got to have that trust. And I really want it to be a partnership because this is my body. You know, I'm not just a rash on the arm or a sinus infection. I'm a real person.
So here's something that comes to question because when like you were talking about the way that healthcare was delivered in the past versus like how we're going from dictatorship to partnership. But there's probably going to be some resistance, like even with the insights that you gather. Did you ever find that there might have been resistance to like some of the data that happened? And just curious about how like working through layers of organizational resistance.
Yeah, so when you're talking about this, you're talking about change management, right? And we have habits and we all have different prejudices. So there was prior to COVID, a lot of resistance on the physicians side of it. I have to see you I have to see somebody in person. You know, it's just not going to work. It's not like those kind of things. They all, when COVID hit, like we all had the mandate, right? How do we stay connected? So they're more open to it. Here's what's interesting now. So, and this is the change management behavior thing. So we're past COVID, although we're in a COVID surge now, but we are also seeing patients in the office. And we want to promote virtual visits. So we're doing all we can on the marketing end. We're doing the digital campaigns. We're doing the blogs, the emails, all that kind of stuff. We have found some practices that when you call for an appointment, and they should offer, do you want it to be in person? Do you want it to be virtual? They sometimes don't offer it or they don't encourage it. And what we've been finding, this is fascinating insight, and the UX people found this as they went to offices to see what was working and what wasn't. There's a fear by some of the office staff that if everything goes to virtual, they'll lose their jobs. To be replaced by, you don't need as many people in the office to do things or to schedule. And so that's been an interesting insight, I think, that we wouldn't have gotten if the UX team wasn't going to the offices, observing and saying to people, why did you not offer a virtual visit to that patient? And as you talk and build trust, then things come out.
No doubt. And without that, we like our response to people not scheduling virtual visits would be like, well, here are the benefits and that, but it would be missing the deeper point of why there was some resistance there.
I think it's human nature. We say, the office staff are saying, what's in it for me? I want bodies in the office. I want to, shepherd them back, or maybe I want that human touch. And then let's give the other reality is that all of healthcare is working with right now in virtual visits is what's the insurance company going to pay for? And so the doctors are looking at their RVUs and, how many RVUs they have to generate. And it's different for an in-person visit than a virtual visit.
So we've gone over the genesis of it, like how you discovered the process and things like that. And then that virtual health use case. I'm curious how patients have been responding and whether or not you see like this virtual health landscape as the long-term future.
It's absolutely the future. I mean, I think it's even more so. And even, as we talk about, we'll talk about this afternoon, is that the challenge too for us as a health system is that our competition used to be down the street, the other two major adult systems in Columbus, and every other health system. We compete against health systems, but there are disruptors left and right. And they used to be nipping at our heels, and now they're chomping. So when you talk about virtual health, there's Teladoc, there's Amwell, there's all these out there that anybody, and they're advertising and marketing to patients in Columbus that wherever they're located. They've got doctors in California and Idaho and everywhere, and people are doing it. It was interesting. I have a millennial friend who never goes to the doctor, never, ever, ever goes to the doctor. And
You're not talking about me, are you?
No, I'm not talking about you. But that is you, right? You're right. You're in that category. So he was interesting. So he never goes to the doctor. And I was talking to him, and he said he had strep throat, and he was taking medicine. And I said, "Oh my gosh, you actually went to a doctor?" I mean, because you got to do that. He goes, "Well, no, I did a virtual visit." I said, "Who'd you do it with?" And it was it wasn't a health system in town. I said, "Now, I think when I've had strep throat, they've had to stick something down my throat and swab it." He said, "No, I just, I did a flashlight. They looked at it, stuff like that, and they called me in a prescription." And so part of me is thinking, is that good medicine? Right? But this is somebody who wouldn't have gone to the doctor and he got medicine. But I need to dig deeper with him to say, all right, why didn't you go to OhioHealth? My guess, I don't think he has a doctor.
Mm-hmm.
So this was easy. He could get online and do it at any time he wanted. But that's the competition we have out there. It's not going to change, and especially with this younger generation. They want simple, affordable, accessible care when they want it, where they want it, how they want it, and that's usually a phone.
Well, I love hearing the nature of that story of using this user-centered planning design, of asking questions of our consumers, because one of the opportunities that these disruptors see is that a lot of these organizations, especially if we bubbled up to the bigger tech companies and retail companies, they're really good at that consumer experience.
They are so good. I mean, retail, everybody goes to the same example, but it's because it's so good. Amazon and Amazon Prime, right? Who doesn't have a Prime account? And they're always feeding things up, you like this, you might like that. And so they're listening. And so, but all the technology and the algorithms. So how can we do that if we know that, you're a runner and, you've seen a doctor because, your knee hurt or something? Well, what else can we not feed up to you necessarily for care, but other services or knowledge? You just want knowledge, because healthcare is all about building that trust, like we talked about a couple minutes ago. And so if we can get some stickiness with you, but we have to meet you where you are instead of asking you to meet us where we are.
Well, the picture that you're painting is all about context. So the context that you ask for, the context that you observe through data points, it's all of the above with that Amazon type experience.
And it's really about it's observing. So you've got to use your eyes. You got to use your ears. You've got to listen. You got to use your mind and ask questions. More than anything, you have to be curious. But we have to remember why we're doing this, and we're doing this to better take care of people. We're not doing it. Yes, there's a business case that we have to have. But one thing that's wonderful, it's kept me in healthcare for so many years, is that we're mission oriented. We're about the people and making them better. And so you can't do that if you don't know them, understand them, listen to them.
Susan, I got to say, we love to see it. And I really appreciate you coming in and sharing the story around that. I love the transparency around it. And hey, there's going to be resistance to some of the insights that you find. And you have to act on that.
Yep.
So for the folks that love to talk and want to get in touch with you, what's the best way people can reach out?
Probably the easiest would be LinkedIn. You can send me a message, Sue Jablonski at OhioHealth. And then my email, though, if somebody wants that, it's Susan, my formal name, Susan.Jablonski@ohiohealth.com.
Okay. Well, thank you again. I hope that your speech goes well. We're really looking forward to that. And hope everybody watching has enjoyed this little taste of HMPS.
Great. Thank you, Chris.
Thank you.
If you want more of the latest from healthcare's thought leaders, subscribe using the button below, or you can visit hellohealthcare.com to get updates directly in your email.